get started. Again, Vice Mayor, members of the council, staff, members of the public, always a pleasure to see you. And we do have a special guest here that I'm going to save the introduction for, because I always want to reserve introductions for very special people. With that being said, call the roll, please, Erica.
Councilmember Bright Cruz.
Here.
Councilmember Fisickelli.
Here.
Councilmember McKay.
Here.
Vice Mayor Jablonski. Mayor Nelson.
Here. We all stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
There's Mr. Stark.
It is indeed an honor and a pleasure that before, even in a different capacity, represented the town of Southwest Ranches and did just such a wonderful job. We were very, very fortunate to have you. And also now as the new mayor of Broward County, that we're just so thrilled and excited and happy and so proud. I have the honor of introducing new mayor of Broward County, Mayor Sharif, that is going to talk to us about the Affordable Health Care Act. So again, Mayor, it's a pleasure and honor to see you. Thank you so much for taking the time, and the podium is absolutely all yours. And my suggestion maybe even is maybe we go out there, because I know that there also is an audience that certainly would benefit from some of the information that you're going to be passing along as well. And I know Representative Stark is here.
Hi. Okay, well, thank you and good evening. I am Barbara Sharif, and I'm Mayor of Broward County, and it is my privilege to be here tonight to discuss the Affordable Care Act with you. I have some packets that have been prepared to follow along with the presentation. And for those who are listening at home, you can request a packet and we will mail it to your home. And all you have to do is call 954-357-7008. That's 954-357-7008. So to begin with, I'm going to try to keep this focused and as compact as possible in terms of time. But in your packet, you'll have three pieces of information. The first is the explanation, which is kind of a summary of what the Affordable Care Act is. The second one is a listing of resources and places that you can go to get assistance if you're having trouble. And then the third piece of information is an application that looks like this, okay? So first of all, I think there's a little bit of confusion about what the Affordable Care Act really is. The Affordable Care Act is a law. It is not Obamacare. It's a law that basically states that all individuals in the United States of America are entitled to health insurance that does not exceed 5% of their net take-home pay, okay? So at this point in time in America, in the United States, we have insurance plans that cause people to go bankrupt because they exceed what their ability to pay is. So under the Affordable Care Act, this law has entitled us to set up a plan to where all the major insurance carriers in Florida are going to partake and become part of it and provide insurance coverage effective January the 1st for those people who don't have insurance coverage or have bad insurance coverage through their carriers now. That means coverage that costs too much. Or people who are in part-time positions who don't qualify for coverage through their jobs. So the first thing is that for those out there who are listening who can apply by the internet, the website is www.healthcare.gov. And for those who have the packet, it is right on the first page, okay? For those who feel like they don't want to go on the internet, you can call in and apply by phone. So that number is 1-800-318-2596. Now, right off the bat, I need two groups of people to understand that they do not qualify and do not apply. That's people who have Medicare and people who have Medicaid. Why? Once you're 65, you go into your Medicare plan, which is run by the federal government, so you do not have to apply for affordable care. You have a better insurance plan than what you can get under the Affordable Care. People who have Medicaid, you do not apply to the Affordable Care Act plan because your income is not high enough to apply to the Affordable Care Act plan. That's why you qualify for Medicaid. So off the bat, those two groups of people need not apply to the Affordable Care Act. The second thing is that in order to make the process as smooth as possible, you will need to sit down and fill that application out and have your information ready. That's your W-2 from each person who works in your household so that you can have your income ready. You'll need to have the Social Security numbers for everybody who works in your household or anybody who lives in your household, even if they don't work. And then if that person in your household has insurance, you'll need to have that insurance card ready so that you can enter it into the system. And the reason for that is this. There's a lot of myths out there. People keep saying that if you have insurance, you can't apply to the Affordable Care Act. That's not true. There are people out there with insurance cards that if something catastrophic were to happen, like them being hospitalized for 4 or 5 days, it would bankrupt them because the insurance companies have such a high deductible that they wouldn't be able to afford it. And that's what's happening right now. So when you have people that have bad insurance plans that are getting hospitalized, we end up paying for it as taxpayers. And they end up getting the collections calls and end up having to file bankruptcy because they've been hospitalized. So we have to stop that, and we have to get them a way to use a better plan and a better method of getting health care. So people who normally don't have health insurance usually use the emergency rooms in the hospitals, which are some of the most expensive methods to get health care. We need to do more preventative care and have people get more affordable care. And so that's what this is about. Most people ask me when we're talking about the Affordable Care Plan, they say, well, what do I choose? How do I know what to choose? So I'm going to give you two very simple tips. If you have insurance already and your deductible is over $2,000, that's your out-of-pocket maximum deductible per year, okay? If it's over $2,000, you go ahead and apply to the Affordable Care Plan, okay? If you don't have insurance and your annual take-home pay is above $26,500, you go ahead and apply to the Affordable Care Act plan, okay? Now, when you get inside the system and you're trying to choose a plan that suits you, I'm going to give you two easy ways to do that. If you're 30 years old and you're invincible, you've never been sick, you don't go to the doctor at all, and you think you're Superman or Superwoman, you choose the catastrophic plan. The catastrophic plan is the cheapest plan that's offered out there under the Affordable Care Act. It's a plan for people who are considered relatively healthy and who need minimal health care, okay? So you may be 30 and under, may or may not have children, you choose the catastrophic plan, okay? If you can afford a better plan, you can go to the bronze. But if you're 30 and under, you're the only people that should be choosing the catastrophic plan. There are 5 plans under the Affordable Care Act. So the first is the catastrophic. The second plan is the bronze plan. The third plan is the silver plan. The fourth plan is the gold plan. And the fifth plan is the platinum plan, okay? These work just like your regular HMOs. Bronze plan is a 60-40, okay? Silver is a 70-30. Gold is an 80-20. And platinum is a 90-10. That means 90% they pay, 10% you pay, okay? Now, when you go in to apply, what you're going to do is you're going to put in your net income. That is your income after taxes, okay? Do not put your gross income in there because then your health care costs will probably exceed 5% of your net take-home pay, okay? So net income is after taxes. So you have to remember to do that because some people are putting the wrong thing in the system and they're getting some really weird numbers, okay? This is an income-based plan, and not only is your income taken into consideration, but also how many family members are in your house. Now, once you put in the number of family members that's in your house, whether it be 2 adults, 2 children, or 1 adult, 2 children, whatever it is, it's going to come up with a premium for you based on your income and the number of people in your household, okay? When your premium comes up, if your premium for the Affordable Care Plan is going to exceed 5% of your net income, then you will receive subsidy immediately on your plan. So once you get your total, and Kelly, I need you to give out the packets so that they can follow with me. In the packets that you have, I want you to turn to page number 17, and you're going to see a sheet that looks like this. And this sheet has, this is a sample that I did for a family that was made up of 2 adults, okay? So they made $34,000 a year. There was 2 adults in this family, and when their plan coverage came out, they could pick out of Coventry, Humana, Aetna, Cigna, Molina, Ambetter, Florida Blue Cross and Blue Shield, a preferred medical plan. When you get inside and you apply, it's going to pull up a page that looks just like this for you, and it's individual to you and the information that you put in. What's significant about this is why the system is clogging up and backing up, because it gives you so many choices and there's so many people participating that people are sitting there trying to click on each of these and figure out which one's best for them. So here, I'm going to give you an easy way to do this, okay? You ready? When you get in and this page comes up, I want you to look at the right column, and it says your estimated monthly premium, okay? When you get that estimated monthly premium, if you are over the age of 30, I want you to choose your bronze plan with the HSA eligible portion. That's the health savings account. Why? Because if you go to the doctor or you have prescriptions, the health savings account will come in handy, okay? Number 2, the bronze plan is the cheapest entry-level plan that you can get under the Affordable Care Act. And 3, once you get out of the application process, a couple of weeks after you do that, you're going to get your card in the mail. You're going to get a booklet in the mail that explains all the insurance plans, A to Z. And you can sit in the privacy of your home in a nice rocking chair without being stressed out and pick and choose whether or not you want to stay on the bronze plan or whether you want to upgrade to a better plan. So once we get you out of the application phase and into the covered phase, you're going to be calling a totally different number that's not overloaded. You can pick up the phone or go back on the internet and change your plan at your leisure. And you can upgrade if you want or stay with the bronze plan. There's no penalty to upgrade. There's no penalty for you to change. There's no fees involved for you to use the customer service line. So that's the quickest way you're going to get out of there. Now, the third thing that I'm going to tell you is this. Everybody, we defaulted to federal resources when Florida chose not to administer the program itself. So what that means is that all of you and those people in those 32 other states are trying to use the same system. We have 392,000 people here in Broward County that need health care under this act, okay? So my other trick is this. If you want health care and you don't want to do it and you keep getting the processing errors in the daytime, set your alarm clock for 3 o'clock in the morning and get up and apply for coverage, okay? 3 or 4 o'clock in the morning works really good, and that's how we've been getting people signed up in Broward, okay? So if you fill out the application in the daytime, get your financial information ready to go, and go to bed early, set your alarm clock for 3 o'clock in the morning, and spend 15 or 20 minutes getting your insurance coverage taken care of. So that's how we're going to circumvent the overload, because most of the states that defaulted are on the Eastern Standard Time Zone. So that means we're all awake at the same time trying to get on, okay? So go on when people are sleeping and you'll get coverage quicker. The second thing is this. If you really have a problem getting on and you really can't wait and you have a pre-existing condition, go ahead and call, because you can call on the phone and you can get through and get coverage. Now, people ask me all the time, can I give you an example of what is covered? So when we talk about income here in Broward County, I have given you on page 5 of the presentation a sample of what a bronze plan costs, okay? The low end of income in Broward County is $34,000 a year, okay? That's your net take home, 34. The higher to median end is $64,000 a year. So what I did is I did an example of 2 families that we put into the system. The first family was a family of 4 making $34,000 annually. That was made up of 2 adults and 2 children. That family's premium after it came up was $1,248 a year. But once the number of adults and children was put into the system, that premium was taken down to $0 because they received a federal subsidy that covered the $1,248 annual premium. So that family of 4 could get health care insurance for nothing, okay? For a family of 2 making $34,000 a year, that's just made up of 2 adults, their annual premium was $2,371. But once the system analyzed their income based on the number of people in their household, their premium went down to $536 annually, okay? The next thing that we did is we went to the higher income, and we did a family of 4 making $65,000 a year. Now remember, this is net, so this is after taxes. So we're just using round figures for that reason. So a family of 4 with $65,000 annually, that's comprised of 2 adults and 2 children, had a premium of $3,851 when we started. Once the federal subsidy kicked in, they received a subsidy of $2,308, which took their premium down to roughly $1,500 a year, okay? There is nothing out there in the market that's that cheap and offers full coverage for prescription drugs, preventative care, pregnancy, pre-existing conditions. There's just nothing out there for that. So this family of 4 can get insurance for $1,500 a year under the bronze plan, and they're making $65,000 a year. Now, for a family of 2 making $65,000 a year that's just made up of 2 adults, their annual premium was $3,295, and they received no subsidy because their premium amount did not exceed the amount that the federal government says that they can afford to pay, okay? So those are just 4 examples of how the Affordable Care Act works. And when you go in, you need to have your Social Security number, you need to have your current insurance coverage if you have any, and you need to have your application completed. Now, whenever I do this, people are in my audience and they complain that they received a letter from their insurance company saying that effective January the 1st, that they will have no insurance coverage. Okay. Under the Affordable Care Act law, what it stated in this law was that if you have a bad plan, your insurance carrier, in order to participate in the Affordable Care Act, has to, in full disclosure, tell you if you could get better insurance coverage. Now, do you think they're going to send you a letter and say, hey, by the way, you've had 3 years, for 3 years you've been paying for a plan that's really, really bad, and you need to get off of it? Or are they going to send you a letter that says, apply to the Affordable Care Act by January the 1st? So when you get those letters, please don't be angry. Be very happy and go ahead and apply for coverage. Because some people have insurance plans that have a $5,000 deductible. I met a lady the other day, and she was so mad that she got one of these letters, and she came to me and said to me, I have an insurance card, and I have coverage, and they just notified me that I have to get off my plan. I said, can you, let me get your insurance card. I looked at it. She had a $10,000 maximum out of pocket. That means that that plan she was paying $260 a month for would cover virtually nothing if she got hospitalized. So she would have to pay $10,000 out of pocket before she would even get a penny of her hospitalization covered. So a lot of people are getting those letters. And what I want you to do is when you get those letters, there's 2 things you can do. You can call in to the number that I have in the packet. You can tell them that you would prefer to stay in the same insurance company that you have, and they will get you a plan under the Affordable Care Act, and you can keep your doctor that you have. The fallacy out there about not being able to keep your doctors is simply not true. Blue Cross and Blue Shield has an open network, and they're participating. Aetna's network is the same for the Affordable Care Plan as it is for their regular plan. Florida Blue's the same network. Better Health is the same network. Molina is the same network. You're not going to lose your doctor. If you want to stay with your doctor and you want to stay with the same insurance company, you can, because every insurance company in Florida is participating under the Affordable Care Act, okay? So you can pick up the phone and say, hey, I have a Blue Cross and Blue Shield plan. It's under such and such a coverage, and I have a doctor that I want to keep, and they will help you to do that, okay? Now, once you apply for your insurance coverage, like I said, you're going to wait a couple of weeks, and you're going to get a packet in the mail. All of these plans, no matter which one you choose, they all cover prescription drugs, they cover pregnancy, they cover pre-existing conditions, they cover hospitalizations, they cover preventative care, and they cover doctor's visits. So when you go into the Affordable Care Act website, you don't have to worry about whether or not you're choosing a bronze, a silver, a gold, or a platinum, because you're going to get coverage. It's just a matter of how much is your copay and deductible out of pocket, okay? The maximum amount out of pocket under the Affordable Care Act for the whole year on the least expensive plan is $4,000, okay? That's why it's a $2,000 to $4,000 out of pocket for any HMO that's out there. And depending on what your financial situation is, you can move up